Hi, my name is Peyton Garner, and I'm going to be talking to you about the function of the lungs. After watching the Teach Engineering video online, I went ahead and made my own lung diagram. So to start, I have the bronchi, which brings the air to and from the lungs. The lungs are the yellow balloons inside the chest cavity here that provide oxygen to the blood and the rest of the body. And then the large balloon here, the blue balloon at the bottom, is my diaphragm, which is used to control breathing. So when the body is trying to inhale, what happens is the diaphragm down here, that blue balloon contracts, and there's space created in the chest cavity, which opens up the intercostal spaces, and that allows for more expansion in the chest. When there's more expansion, the pressure in the chest the increase in volume in the chest will allow for a decrease in pressure. Therefore, the inhalation can occur. So when the diaphragm contracts, the lungs can expand. So when talking about exhalation, the lungs are elastic and they will want to recoil after that initial inhalation. So at this point to exhale, the diaphragm will then retract back, and that creates a decrease in volume, which will allow the pressure to go back up, which will allow us to exhale at that point. So the air that's going to rush out of the airway is because there's no contraction from the diaphragm anymore, which is also known as a passive process. So the exhalation is passive at this point. Talking about the lungs, which again is the yellow balloon in the bottle here. So the question is, why do some people have larger or smaller lung capacities than others? So how to answer that question is basically if one, it can be on genetics. So if there's bad genetics in that family, which could probably be from some sort of asthma or lung disease. There's also bad habits like smoking, lifestyle atmospheres like secondhand smoke, your job, external factors, all can have a big part of how the lungs contract and recoil. So there are some things we're going to get into here talking about asthma, but there are other things too, like emphysema and COPD, that can have issues with the yellow balloon in here being the lung. So larger and smaller lung capacities have to do with genetics as well as other lifestyle and atmospheric choices. So just talking about the lung structures themselves and why different lung capacities might also be an issue. The right lung is wider than the left, but it's also shorter because it has to make room for the liver, which is right beneath it. And the left lung is narrower because it has to make room for that heart. So depending on the size of the person's organs and things like that can also have an effect on the lung capacity of the patient. So a patient with asthma runs the risk of having an asthma attack. In an asthma attack, the airways of the actual lung can become inflamed, making it harder for them to breathe, along with some swelling that can happen in there. This means that the membranes that the airway has along all the way to the lungs can secrete extra mucus. That extra mucus can result in the patient having what is known as an asthma attack. So, which can cause other symptoms like making it harder for them to breathe, wheezing, coughing, those types of things. So the unfortunate side of things is that asthma, if left untreated, can permanently misshape the lungs and the airways and how they normally function. In someone without asthma, that process can become disrupted in a patient who has asthma. The actual bronchial tubes, which are my green straws here, can become thickened and scarred or have issues in their transferring oxygen into the lungs. So that person may have decreased lung function because of their asthma over time. So the priorities for the nurse when treating someone with asthma, obviously we need to assess their airway and their breathing. So the nurse will go ahead and assess their respiration pattern, breath sounds, and their oxygen level. Because the patient is not getting, their nursing diagnosis would be ineffective airway clearance related to the increase in the bronchial spasm, the nurse needs to intervene and maintain that airway. And that can usually be done by some medication management like albuterol, levobuterol, or other immunodilator medications that can help during an attack. But long-term treatment can also be like a corticosteroid over time that can probably help with their asthma, along with breathing treatments done over time, things like that. The nurse will want to, outside of medication management, the nurse will want to help the patient sit up straight to help with that airway clearance. The patient will want to have them remain calm because it is a scary time. Remaining calm and trying to control those deep, long breaths if they can can really help with their asthma attack. The nurse will want to go ahead and educate about maintaining the medications, taking them as instructed by the physician, and keeping up with the management of asthma, like getting those breathing treatments done. The nurse will want to help teach the patient to monitor for triggers during the asthma attack. Stay away from the trigger if you can, but learning what triggers you and learning how to avoid those things would be a lifestyle change that the nurse might need to educate the patient about. The nurse will also want to educate the patient to have a quick inhaler with them at all times, just in case they do run into a trigger unexpectedly, those types of things, and then just avoid those triggers if we can. And finally, some community resources. All of the EMS services have experience with handling asthma attacks. They're able to administer the albuterol if needed. There are local urgent cares that have breathing treatments available along with your hospitals and those types of things. Emergency rooms know how to handle the breathing treatments for you. There's also research being done by the American Lung Association all the time on how to better treat someone with asthma. And also a big one is the schools are well trained and have to go through different classes and courses to learn about the treatment of asthma, especially if they have an asthma patient as a student at their school. So they're well trained there. So that's my video about the lung function and my diagram. So hopefully we learned something and hope you enjoyed the video.